Assalamualaikum class and a very good day to all. Hopefully all are in a good condition. So today we're going to proceed on our new lecture which is on nutrition monitoring, pemantauan pemakanan, status and research in Malaysia. Okay. So what we're going to learn today. So the first thing is that we're going to understand the food security and nutrition security. We're going to learn about nutrition monitoring in Malaysia. What are the survey or what are the studies that have been done in monitoring nutrition in Malaysia, and I want to know the nutrition situation in Malaysia. So what is the current situation of nutrition in Malaysia? Apakah keadaan pemakanan in Malaysia? Bagus ke? Tak bagus ke? And then we're going to understand the changes in dietary and behavior. And then we're going to learn about nutrition policy. And then we're also going to learn about nutrition programs and services. And the last one, we're going to learn the nutrition research priorities. All right? That's a lot, right? So it's okay. So food security and nutrition security. So what does it mean by food security? I think this has been covered before in your previous course in pemakanan kesihatan, if I'm not mistaken. So by default, you already should know the definition of food security. So it is defined as exists when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food to meet their dietary needs and food preference for an active and healthy life. Maksudnya, food security ni adalah apabila kesemua orang pada bila-bila masa mempunyai physical, social, and economic access access ni ke access, ada access lah towards physical, social, economic terhadap access terhadap kecukupan, keselamatan dan kesihatan makanan. Alright? So in other words, we could say that it can access by all people at all times to enough food for an active and healthy life. So sekarang ni pada zaman pada zaman pandemik COVID ini, adakah kita rasa-rasanya kesemua penduduk di Malaysia mempunyai food security ataupun kita sedang menghadapi food insecurity? So what does it mean by food insecurity? Food insecurity is limited or uncertain ability to acquire or consume an adequate quality or sufficient quantity of food in socially acceptable ways. Okay. Food insecurity maksudnya terdapat limitation ataupun terdapat makanan yang terhad ataupun makanan tersebut ada tapi kita tak boleh, kita tak ada ability ataupun tak ada kemampuan untuk makan ataupun mendapatkan makanan yang cukup kualitinya dan mencukupi dalam socially acceptable ways. Maksudnya dengan cara yang sepatutnya lah, bukan melalui mencuri ke ataupun melalui keadaan yang tak sepatutnya. So these are some of your senior studies that have been done on food insecurity. Some of them have been done on fishermen household, food insecurity among fishermen household. Some of the studies have been done on university students at the level of university students, because there are some of university students that are having food insecurity whereby they only eat maybe perhaps one meal per day, or even they have not eaten any meals at all per day, right? And some of the studies have been done on the children in certain districts, right? Therefore, who are the food insecure? Because we're talking about the food insecure, so who are those food insecure? So they are the poor, the working poor, even though they are working, but they're still poor, the young, because they have no accessibility, they have no ability to go to get themselves food, because they are just waiting for food from their parents. And then the ethnic minorities, older adults, inner city and rural dwellers, the homeless. So some of the urban area in Kuala Lumpur as well, we have lots of homeless people which are prone to food insecurity, right? So poverty is the highest identified reason for food insecurity and hunger. Okay. problems of poverty is because food is available but not accessible to the poor who don't have land or money. Sometimes we have the food, but the poor are not does not have access to the food because they have no money to buy the food. And 60% of the developing world's population suffer from chronic undernutrition that is very high. So found in countries that can neither produce enough food nor earn enough to import it. Some of the countries are not capable to produce and are not capable even to import the foods. So nearly 25% of the world's population suffers form of malnutrition. Now we hope that Malaysia is not going towards this kind of condition, because we are in the status of COVID, and some of the countries started to lock down their foods from importing to us. So we do hope that this pandemic COVID would end quickly. And nutrition security is assessed by every member of the household or community to adequate and quality diet. So nutrition security is that the household have adequate and quality diet so that it can enable optimum growth and development. Why? Because it is important, it is crucial to prevent under and overnutrition. So that is more specifically on nutrition security. And these are the food system. It is from scratch, which is from the growing until disposal of food and food related items. Right? So how is the nutrition monitoring in Malaysia? So in Malaysia, lifestyle and dietary habits of nation over the last decade were influenced by family and social environment, which affected nutrition status of the community. So we are going towards reduced physical activities, and changes in diet are the contributing factors of overweight and obesity. So in Malaysia, we are experiencing, or we are facing what we call like triple burden disease. We have undernutrition, we also have overnutrition, and we also have stunting. So national nutrition surveys are carried out to set up baseline and social diagnosis data. So we have the first Malaysian adult nutrition survey, which the acronym is MANS, which is done on the adults only, aged from 18 to 59 years old. So the first MANS was in 2003, and then we have the second MANS, which is in 2014, which is almost a 10 years gap. So the Ministry of Health would carry out this survey, the census, about 10 years gap. All right. So the following one would be in 2024, the following month. Okay. So and the second one is the National Health and Mobility Survey. We have until now we have several of National Health and Mobility Survey, and then we have Malaysian Non-Communicable Disease, NCD surveillance. But the most related to nutrition is this one, Malaysian Adult Nutrition Survey. However, we have limitation in terms of the Malaysian Adult Nutrition Survey. What do you think are the limitation? Jeng, jeng, jeng. Yes, some of the limitation is that the Malaysian Adult Nutrition Survey, it does not involve the adolescent, the remaja, it does not involve the elderly, and it does not involve the vulnerable groups, infants, toddlers, preschoolers, pregnant women, elderly, and indigenous group, because it only covers the adults from 18 to 59 years old. Alright, but now we already have, the Ministry of Health has already conducted an adolescent nutrition survey 2017. Okay, it called as ANS, ANS 2017 for the adolescent. Right? So there is also an emerging need on the behavior and social economic issues such as risk behavior and social economic factors on food consumption, national study on food and nutrition security. And then we also have the food composition table in Malaysia. So we have the food com, right? I think you already have to know about the food com, the green one, buku hijau tu yang the food composition, yes. So that was in 1997, the first food com developed, but until now it still have not yet published the latest one. So how many years does it until now it took to publish a new one? So what we already have in the website we call My FCD, My Malaysia FCD, food composition database, that you could refer to on the online. Later I will show you. So however, the food composition table that we have now is limited to several data only. So we are lacking of data on zinc, selenium, vitamin D, vitamin B12, folic acid, fiber, fatty acid, and iodine. So you need to know, or you need to remember all these lacking data if it will be asked in the test, perhaps. So we have know about the nutrition monitoring. So we monitor using some sensors like Malaysia Nutrition Survey. Now we're going to look at the nutrition situation in Malaysia. How is the current situation of nutrition in Malaysia? So if you could see through the papers, there's more news on obesity, more news on obese adults and children. So we could have an idea and insight of the current situation. So for the first thing first, which is the food consumption in Malaysia. So how is the trend of food consumption in Malaysia? So if you look at the food consumption in Malaysia, the consumption of calories from animal product is increasing and decline in calorie from cereals. So these are towards the westernization diet, where the animal product is increasing in terms of the calorie intake contribution from the animal product, but it declines in the calorie from cereals. It means that nasi makin berkurang, but the calorie daripada haiwan, daripada daging semakin bertambah. There also an increase in the proportion of calories from fat, limited varieties of food consumption in low socioeconomic groups. So makanan, kepelbagaian makanan tu sangat terhad bagi mereka yang socioeconomic mereka rendah. So and also low intake of micronutrients. Micronutrients involve vitamins and minerals is so low in these vulnerable groups. And breastfeeding, exclusive breastfeeding, which is from 0 to 6 months old, is very low among the population. So there are some emerging issues that's growing up, which is the functional foods, genetically modified food, health claims on foods and dietary supplements. So there's a lot of health claims happening in foods and dietary supplements in Malaysia. We're still tackling on the issue. So these are the things that when we say the current situation of food consumption, these are the things that are happening now. And the second thing is what is happening in terms of nutrition status in Malaysia. So in Malaysia, we still have the protein energy malnutrition, which is issues in regards to protein energy lacking among children from low socioeconomic status. Poverty is still a major determinant of health and nutrition status, and we also are facing anemia among the young children, adolescent girls, pregnant women, and the elderly. And we also have the issues of iodine deficiency disorder, which is in some rural areas, especially in Sabah, Sarawak, and some island. For example, in Pulau Redang, in Pulau Perhentian, when we did some survey on the children, we identified that there are several of them. There's quite a number of the children that have high iodine deficiency, even though they are near towards the island where they have lots of seafoods and some of fish, but still they have iodine deficiency disorder. So the question is, why would this still occur? Because some of the residents said that walaupun mereka banyak makanan ikan-ikan, tetapi kebanyakan ikan-ikan makanan laut mereka import kepada turis ataupun import bukan untuk makanan mereka export kepada pasar-pasar untuk didapatkan duit. Bagi mereka duit itu lebih penting. Okay.